Action.
Hi, my name is Heather Pohat. I'm from Alberta, Canada, and this is my husband, Gary.
Okay.
And we came down because, I researched you on the web. I was looking into lap band surgery, and I got referred from a site that I was on to your site and started reading, and I've soon decided that lap band surgery was not the route for me and that this was. So we made arrangements and came here. I had my surgery on Thursday, and I weighed myself this morning. I'm down 9 pounds, which is amazing. The last, I don't know, probably 10 years, I've been diabetic for 12. The last 10 years, I found it very, very difficult to lose weight. I would, go on a like Weight Watchers or whatever program I was on, and I would stick really hard to it. And I would exercise and do all the stuff that I needed to do, and I would just lose so minimally that I would get discouraged and just quit. So 9 pounds in a week, even if it's just water weight, is really encouraging. So I've had...
How's your diabetes?
My diabetes is my blood sugars are slowly coming down. My blood pressure is down really well. In fact, sometimes it's a little bit too low. I'm getting a little woo-woo headed.
And can we stop and interrupt you for a second? Your blood pressure will go down after the surgery. It can go so low that you can pass out, especially in the first days and weeks after surgery. That's why you need to keep up on your salt. And you can keep emergency salt with you. You should have a fanny pack or a purse that has Gatorade or tomato juice or saltine crackers in it to constantly work on during that week. And again, though, you had high blood pressure and medicine for high blood pressure on the day before surgery.
Right.
And no more high blood pressure medicine or high blood pressure after surgery.
No.
Diabetic medicines before surgery.
Yes.
And what were they?
I took 3 metformin a day and 1 Actos.
Okay, and since surgery, how much diabetic medicine have you taken?
None.
Pardon me?
Absolutely none. So anyway, that's, I think I'm developing a little bit of thrush.
You want to show your tongue to the world? Is it sore?
In a little bit.
Okay, then you know you can have the nystatin. The reason that our patients get thrush, to let everybody know, is that when you start to starve the body, it burns some fat. And you may remember from the ketogenic diets you've been on in the past that you would get these little sticks you would put in the urine to see if you were becoming ketotic. Those ketones, as you burn fat, are in the bloodstream, and some of them go and get into your mouth. And so you get a ketone mouth that is like acetone. It's an icky taste. It's like a metallic taste that you can't quite clear up. You can't brush it to make it go away. And that will stay there for several weeks and then gradually get better. As the ketones are in the back of your mouth and in and around your teeth and your tongue, it changes the environment for the bacteria that live in there. And so sometimes you can get an overgrowth of a fungus called Candida. And that causes thrush. And then the treatment for that is the antifungal agent called nystatin. And you have a prescription for that you can get here if you need it.
Okay.
And don't hesitate to use it. And sometimes they say swish and spit it out. Sometimes they say swish and swallow it. And you could go either way with that.
Okay. Other than that, I haven't had any problems. My ports are healing up nicely. They've been itchy the last day. I have used one patch. I was trying to describe this movie that I wanted to go and see the other day, and I was starting to, get teary and stuff, and I thought, good grief. Perhaps it's time for a patch.
We also went and saw that movie Georgia last night, and she cried all the way through it. So.
Yeah, but that's sort of normal for me. But anyways.
Well, the patches, again, to be emphasized, the patch is used just like a nicotine patch when you quit smoking to help in the transition from before surgery to after surgery. Okay? Before surgery, high estrogen, abnormal estrogen, and after surgery, back down to low. But that sudden drop can pull away so much estrogen so quickly, you get a withdrawal effect. And that withdrawal effect can make you sad and tearful or angry and grumpy. And the estrogen patch is not to be used for a long time. It's usually in about 20% of our women, and they usually use it for about a month, some people a week, some people 3 months, but the average is a month. Should we take out your staples?
Sure.
Okay. Okay. Oh, you look good. Hold real still. Applause.